Good morning, everybody. I'm Sam Melnick, Chief Communications Officer for the Massachusetts Health and Hospital Association. On behalf of MHA, I want to welcome you to today's Executive Insight Series webinar. We are excited to host this unique series, which features candid interviews of hospital leaders and will continue throughout the year 2021. Today's theme is Advancing a Community Through Care. Just a few logistics before we start. We will be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have questions during the webinar, we encourage you to enter them through the chat feature. Questions will come directly to us, and we'll do our best to address as many as we can during our time here today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I want to take a moment to thank MHA's 2021 sponsors for all their support in underwriting MHA's education programs. And in particular, I would like to thank today's program sponsor, Pfizer. A valued annual sponsor for MHA, Pfizer is one of the world's premier biopharmaceutical companies and a leader in the COVID-19 vaccine space. Now I will hand it over to Kristin Oliveira, Vaccines Account Manager from Pfizer, to say a few words. Kristin?
Thank you so much, Sam. So hello, everyone. As Sam said, I'm Kristin Oliveira. I am actually joined by my colleague, Tim Temple, who you cannot see here, but we are both Pfizer vaccines account managers. And we are a brand new sponsor to MHA, so we are really thrilled to be part of the MHA community. I only have a minute here, but I'm just going to talk a little bit about what we do as vaccines account managers. We're primarily focused on improving the rates of all CDC recommended vaccinations in the state of Massachusetts, and that includes pediatrics through adults. We do this by working with, of course, health and hospital systems, FQHCs within the state, and even regional payers. And so the hope is to create innovative solutions that align to these networks' unique immunization challenges or barriers. And typically, many networks are struggling with similar challenges. So, Tim and I work every day to gain a better understanding of these particular challenges that you're all facing on a daily basis. And over the years, we have really developed some meaningful relationships and partnerships with customers like you guys. So we're always willing and happy to connect people together that can work towards valuable solutions to reducing these common barriers to immunizations, especially in the most vulnerable populations. So if anybody would like to meet Tim or I, just to have an introductory conversation, please reach out to Sam or Lindsay or Lori, and she can always put us in touch. So now I am very pleased to announce our moderator for the morning, Steve Walsh, President and CEO of the Massachusetts Health and Hospital Association.
Thank you very much, Kristin, and thank you, Sam. Thanks, Tim, for being here as well. And thank you for your sponsorship, and thank you for all your incredible work. To say that you are literally saving lives at this particular time in history would be a gross understatement. The work is truly remarkable, inspirational, and incredibly important to all of our communities and to the community that we're going to talk about this morning. This morning is our 6th episode in our Executive Insight series. Those of you who have seen our previous episodes know it's an opportunity to highlight some of the incredible backgrounds, viewpoints, and works of Massachusetts healthcare leaders. Today, it's our pleasure to be joined by yet another strong voice for our community hospitals and for our healthcare system, Deb Wilson. Deb has over 37 years of experience in healthcare leadership, finance, and operations. Deb was named CEO of Lawrence General Hospital in February 2020, just weeks before the COVID-19 pandemic struck here in the Commonwealth. She first joined Lawrence General in 2001 as Senior Vice President of Finance and CFO, and then Executive Vice President before taking the hospital's top post. Prior to her 10 years at Lawrence General, Deb served as CEO of Bridgewater Goddard Park Medical Associates, a large multi-specialty physician practice, and as the Senior Vice President of Operations at Signature Healthcare. She obviously also previously worked for Partners Healthcare and Deloitte. Deb now oversees LGH's strategic initiatives and its complete array of services to the greater Lawrence community. Most importantly, she has been a strong voice for our healthcare system, our community hospitals, and patients in the Merrimack Valley. It's a privilege to have her serve on our MHA Board of Trustees and as chair of our Standing Committee on Finance. Deb, thanks so much for joining us this morning, and welcome.
Thank you, Steve, and thank you for having me here today.
And to kick things off, you and I have talked previously. You come from a financial background, so now you're the CEO of one of our most important community hospitals in the middle of an urban center. How did you get from there to here? What led you into healthcare, and talk a little bit about that transformation to the role that you're in today?
Well, I know we're all, I'm sure we all look back at our histories and say, how did we end up where we are today? But, I was an accounting and finance major, took a job with Deloitte, thought I was going to take a few months off in the summer and start in September. And they called me and they said, we have exciting news. We just won the Brigham and Women's Hospital audit. And this was a long, long time ago. The Four Partners was formed. But I ended up being on the Brigham and Women's Hospital audit, starting from a staff accountant and ending up being a manager at Deloitte. So everything I learned, as part of that process. And then I ended up staying in the healthcare industry for the rest of my career. So it's an interesting, thing to say you start in accounting and finance, and then you end up as the CEO of a hospital. I think part of that was the 12 years I spent down in the Brockton market, really working very, very closely with physicians for that 12 years. So even though the finance background was important, I really spent most of my time with them, running the ambulatory sites and learning about clinical care and learning about what's important to patients and what's important to providers and practicing physicians.
So you've been at this a while now, and you've served in multiple roles. And I know that you always take time out of your schedule to mentor young leaders, young women moving up in the healthcare space, always working on the pipeline. And we get a lot of emerging leaders that join our sessions just to hear from CEOs and what's on your mind. Any advice to some of our emerging leaders that might be listening this morning that want to pursue a career as a healthcare leader?
Well, the first thing I would say, it's a wonderful profession. Taking a career, the days are long, and being successful, it requires a lot of hard work. But when things get tough, if you're in healthcare, you can at least say that at the end of all this, you're impacting a patient. So I would highly recommend a career in healthcare. I think it's been great. That doesn't mean that it isn't challenging. We all know there are resource constraints, and sometimes when I think about spending 12 years in Brockton and now over 10 years in Lawrence, I think that my destiny was to spend my life in under-resourced situations. And what I would recommend to emerging leaders is, certainly healthcare, there's so much that can be done. There's so much that can be improved. And I would highly recommend to use that mentor opportunity, and also to participate in different, networks and learn from as many different people as you can about what they're facing and what their challenges are. I spent a lot of years on the HFMA board, and I've made such great connections, and it was, still to this day, I have great friendships from that. So again, participate, get that mentorship, and then, the healthcare career is, obviously at the end of the day, we're helping patients and communities. So it's a great way to spend your career.
Yeah, and you mentioned helping communities, which I know is always top of mind for you. So let's switch to that for a minute. I mean, even before COVID, Lawrence was no stranger, and you were certainly no stranger to leading through crisis. Lawrence General was at the center of the gas explosion disaster before the pandemic hit. What's been your approach to leading with a level head under all of these high pressure situations that you've been in?
So the gas explosions, I guess what I would say, there is sort of an inside joke here at Lawrence General that if something is going to happen, it will happen at Lawrence General. Sometimes we're just amazed by the things that are happening up here. But, that situation was really the leadership of the governor and our mayor, Dan Rivera, who really just jumped in and helped the community deal with such a devastating situation. My team here, the emergency center, is, of the highest caliber. We're a level 3 trauma center. So the preparedness and the readiness and the talent is really so important. So I guess what I would say is, when we think about, do we get these accreditations? Do we recruit that talented professional? At the end of the day, it can mean the difference between a successful outcome and a not so successful outcome. I do remember recruiting the orthopedic traumatologist who's still with us. And I remember interviewing him, and he had a wonderful life story, professional hockey player with an injury, decided to go into orthopedic traumatology. And I thought long and hard about hiring him. And he was one of the best things we ever did. And he did, in fact, when the chimney blew off when the house blew up, there was a young girl in the house, and he did dozens of surgeries on her, saved her life and her limbs. So I guess the level head part, you have to have the team around you. You have to have the dedication and the talent. And then it's obviously letting everyone know that they're not alone, that it's a team, that it's not on any one person to save the day. But some of the work you do way, way in advance that you don't even know will end up being so impactful is really what I think about when I think about the gas explosions.
And then we turn the page to COVID. And now I'm sure you have a laundry list of things as the new CEO that you're going to do at Lawrence General, and improvements and continuation of good work that you want to do from your predecessor. And now here we are, and it's COVID. How does that first few months look for you? And Lawrence was obviously one of the hardest hit communities. Just can you talk a little bit about day to day, how you were doing and how you were managing the community needs?
Everyone asks that question about my timing in life, and you decide to become a CEO, or it happens, and 1 month later, COVID hits. In some ways, leading an organization in a crisis like COVID can be easier than trying to lead an organization and determine the best strategy, because at the time you have one goal, and that is you have to deal with the crisis at hand. We were, like all the other hospitals on the call, incident command structure, you're communicating constantly. So it does make some of the leadership a little bit easier. It doesn't make the reality any easier, but it makes the leadership easier because you've got everyone's attention. I think that the hardest part for me about it is, we did serve the community well. We were really inundated with very sick patients. Most of our beds were taken up dealing with COVID patients. We lost a tremendous amount of volume being where we are. And, now the hardest part for me is that to come out on the other side, we haven't received COVID relief since July of last year. And, being a leader of an organization that is in such a financial crisis is truly a challenge. And, my goal would be to say that the community does need services and service levels that we provide, but you have to have the funding necessary to do that. So being the leader now is really, really challenging, I would say.
I imagine it's probably going to be the most challenging portion of your career, right? You make it through the COVID pandemic, and now I think it's no secret that some of our hospitals, including yours, are weaker coming out of this than they were going in. And I imagine you have your hands full right now, trying to continue your mission and your vocation to serve the Lawrence community.
Absolutely. And, I think if you think about what happened last year with George Floyd and the attention to all of the issues around racism and all of that, I think that if we just step back from that and say, people of color and communities like ours, they may not know what they won't have if this doesn't go the right way. They don't understand the under-resourcing impact, but I feel like it's a moment in time, and I'm encouraged by the leadership that around me that says that this is going to get sorted out, and so I remain optimistic.
Yeah, well, you always have been, and certainly you're an incredible advocate for your community, your hospital. And so let's talk about the community just for a minute. I know that you are in the middle of it, and you do so much work outside of the walls of the hospital, and it's important to you and important to the mission of Lawrence General. Can you talk a little bit about what's happening in the community and how you assess the community needs and where you put services?
Sure. It's funny with COVID, we spent so much time outside of the walls of the hospital. I remember my senior VP came into me and she said, the health center and Mass General Brigham and the city and the state want to form an 8-lane testing site. And we should do this. And, I remember literally that moment where it's like, well, that sounds great, but how much is this going to cost and can we do it? And we formed a wonderful collaboration with the city and the state. And we got up to 1,700 patients a day across the street from the hospital. And then when the vaccines became available, we opened up at the South Lawrence East School, again, with a partnership with the city and with the state. So I would just say that we definitely moved from just focusing on our hospital operations and our ambulatory sites to what the community needs. We do have an accountable care organization with our federally qualified health center that's really right next door. And we are the members or the owners of our accountable care organization. So through that vehicle, we really focus on population health and the significant issues that our community faces relative to social determinants of health. And we've made progress over the years.
And so I know with your ACO, you're incredibly close to your patients and you know what's happening in the community. You really have your finger on the pulse. And you mentioned the vaccines. Can you just talk a minute about how that's going and what kind of work your team is doing to educate and to vaccinate and to hopefully make people comfortable?
So we also have a grassroots organization called the Lawrence Partnership, and many civic leaders participate in that. And we've done vaccine education. We also are working with the city with a mobile unit. We drive into the city and offer vaccines, and that has been, we're doing less of that now, where the demand, it's really an issue relative to people's willingness to keep going on the vaccine front. But I guess what I would say is we're very close with the city leadership and the state and our community partners like the health center to figure out the how and the where and how do we get the vaccine numbers to a higher level.
Yeah, you mentioned your relationship with your elected leaders. I know you're always advocating with the delegation and the mayor and Secretary Sutters and the governor on behalf of the community and really a model in that. And so there's a lot of other big issues that are happening, right? COVID came, but it didn't stop the other things that you were working on that were priorities of your team. And we know that, the epidemic within the pandemic became behavioral health challenges. Can you talk a bit about what you're seeing in the community inside the walls of the hospital on behavioral health needs?
Yeah, we saw our emergency center is a very busy emergency center. When I came here back in 2011, it had 78,000 visits a year. And then through a lot of work through the waiver, we tried to reduce non-emergent visits, and we were running at about 68,000 visits a year before COVID. And obviously volume went down after COVID, and now we're starting to go back to pre-COVID levels. So it's a very busy emergency center, and behavioral health is a real issue, as all of us know, but our census doubled. And it's very, very challenging to place these patients. Again, this is a resource issue too, as far as being able to staff and support the needs of these patients. I'd say we do more in the realm through our accountable care organization and the primary care that comes through that end than we can do as a hospital.
And I imagine we saw today that the challenges with substance use disorders has gone up as well. I imagine you're seeing that within your community as we come out of COVID and begin to refocus the efforts. That problem hasn't gone away for you.
No, it has not. It's very serious. And, again, the accountable care organization structure and identifying high-risk patients, and we have a whole program around, frequent visitors and multi-visit patients. And I think there's just been a lot of great work and infrastructure that was put around trying to deal with the real issues that this community and other communities face. But we all know that it's just become harder for people, the isolation, the economic challenges. And so it's very, very real. And obviously, I think that, future investments in that area are going to make a lot of sense and are very important. And
you mentioned the ACOs or accountable care organizations a couple of times. you were at the forefront of this 5 years ago, and I know there's a new waiver coming up to extend the work that the state has done on accountable care. Are you seeing improvements through your connection to your patients through the ACO?
So we have, there are quality measures that, we look at, and definitely we've seen an improvement for our population in those measures and scored well from a quality perspective. I think there's still so much that can be done. I will tell you that when we looked at the mortality rate for our Hispanic population from COVID, the issues that they have relative to social determinants of health, it really, really negatively impacted their mortality. So, there's so much to do, and starting at the very beginning to try to have a healthy population, but it does impact mortality. So it's definitely a worthy goal and time that needs to be spent.
Yeah, it's great work by you and your team, and it's still obviously novel. And so you are doing a lot of things on a shoestring. You're doing a lot of things really boots on the ground in the community. Are there some creative initiatives that you haven't talked about yet that you think other hospital leaders and organizations can learn from that you're implementing in Lawrence?
So there are some things that we've done that we're very proud of. The neonatal abstinence program. We ended up on the front page of Time magazine, the Cuddler program, and all that. But thinking about all of our important issues right now with the diversity, equity, inclusion, we immediately started to think about revamping our own committee, and we realized that we needed other voices. So we formed a joint committee with our health center and brought in their leadership. And I think it really is amazing how, depending on what organization you work for or what you do for that organization, you bring a different perspective. So I think the willingness to sit down with another organization and figure out where we were not doing a good job and where we really needed to focus, I think was creative and innovative, and it's been productive. So we've made some significant changes based on the dialogue that has occurred, and we've heard people's stories of where we definitely need to focus. So I think that forming that joint committee with our nationally renowned health center was our residency program, I should say, was very, very important. And we're hearing from the future physicians, and it's been great.
It sounds like you really have a two-way communication line there, and are really doing as much listening as you are leading, and that's obviously critically important for all of our members to learn from. We have a few questions coming in on the chat, and one of them is kind of about those collaborations. Can you talk about some of the relationships that you have with other hospitals and hospital systems in the Commonwealth?
Yeah, that's a great question. Obviously hospitals compete, they share markets, but through COVID, those walls really were knocked down, and I have a very good relationship with Holy Family and Lowell General and Emerson. We all, and even Southern New Hampshire hospitals, and we all came together and really had to figure out what should we do for our patients in a crisis. So we collaborate locally where we can. We definitely, we're an independent hospital. And I think that, you find that high Medicaid hospitals across the state, many of them are independent. I think that is, obviously a challenge, but nonetheless, we are collaborating wherever we can, because it's very hard to do everything by yourself, and collaboration really does make a difference.
Yeah, you said it again, and we've said it, and it just never gets old when we talk about it. The entire Commonwealth became one hospital, one health system, one workforce in order to meet the needs, and truly remarkable. And so thanks for reminding us of that effort. And then we take a breath. We think COVID, certainly the public thinks COVID is gone, and people are traveling and planes are full again. And are you concerned at all? A question came in about the recent uptick in COVID cases, and any thoughts about whether or not we could be back in this at any point in the future?
Yes, I'm concerned. I'm concerned because, I look at our workforce, and I was rounding the other day, and, there's no way to say it other than the front line. It has definitely been, traumatized by what they had to see, and the families that couldn't be with their loved ones. And I worry that, a third surge is just, one surge too many. Not only from a resource perspective, financially, but just from a human perspective. I think people are really worn out, and we're trying to do things to, reward our staff and thank them. And, we have competitions and ping pong tournaments and all kinds of things to kind of brighten up the day. But the reality at the end of the day is, a third surge of the magnitude of the second surge would really, really be, yet another crisis to handle. I know we'd all do, our best, but we are facing workforce challenges. I think that I know that's, a common theme, but it's hard to recruit. It's hard to replace. And there's, the volume's growing fast, and, we're struggling to keep up with it.
Yeah, I know the workforce has been something you've talked about, and that was kind of even a worry about the pipeline before. Are you seeing workforce that are either retiring or leaving the profession, and maybe COVID was just the last straw? Do you see that at all, Lawrence? We
are seeing that. And we, we're seeing also very competitive offers for people to go elsewhere. We do, like every other hospital, we do market studies, but it's a very competitive landscape. And we have people saying, I'm ready to retire now. And so non-COVID related, what do you see in the next year in terms of healthcare in general across the country? Any crystal ball where you think things that we might be working on, or things that might happen that might be able to positively impact the work you're doing in Lawrence? Well, I think that the value of community hospitals in the COVID situation, at least I think we've convinced ourselves that community hospitals have a role to play in the healthcare delivery system. So I think that all of us have to figure out, what will happen outside the hospital walls, and how can we deliver care in a more efficient way that's more patient focused and patient friendly. And I think COVID taught us a lot about what is possible. For a community hospital, it's whether or not they'd have the resources to participate in the transformation opportunities. So I believe there's plenty of opportunities to deliver care better, in a better way, more efficiently, in an ambulatory setting. But I think the challenge will be, will the community hospitals be able to fund that transformation?
As we're coming up on our time, and I'm just pleased that we didn't talk about that question before, and I'm just pleased that you answered it the way I kind of hoped and thought you would, which is right back to what your mission and vocation is, which is the importance of the community hospital. Better than anyone how important it is for Lawrence, for the workers that you employ there, for all of the things that you are able to do for the community and with the community, and then for the care that you're able to provide to your patients. So I know how important Lawrence is to you. I know how important that hospital is to the community, and certainly know that you are doing everything that you can to make sure that the hospital can survive and thrive into the future. So thanks for all you're doing on behalf of Lawrence and on behalf of healthcare within the entire Commonwealth.
Thank you.
I want to thank you for taking some time today just to talk about your journey and talk about the work that you're doing. Obviously, it's impressive. We could go on and pull the string on any of a number of things that you discussed. But we certainly appreciate your time here this morning. As we come to the end, thanks again for joining us, and thanks for your leadership, both here at MHA and in the entire healthcare community. We certainly know that you and all of us have some hard work to do as we emerge from the pandemic. But with your leadership and partnership, I know that everyone that joined us this morning can agree that we can build something that's even better for our patients and our workers in the years ahead. Thanks again to Pfizer and all our sponsors, and to all of our attendees for being a part of today's Executive Insight series. You certainly make this possible for us to do. MHA offers great programming on a weekly basis, We encourage you to visit our website for more information on what we have in store. You can join our next Executive Insight session on September 30th, when we will be joined by Dr. Asad Saya, CEO of Cambridge Health Alliance. And we also encourage you to mark your calendars for MHA's upcoming Fall Leadership Forum and annual women's conferences. These will be 2 can't-miss education events. Thanks again for spending your morning coffee with us, and have a great day.
Thank you.